Hello students, what is deprofessionalization of medicine? Deprofessionalization of medicine is actually in your book Park. See the involvement of community health workers, Anganwadi workers, multi-purpose workers, practitioners of indigenous medicine, social workers in the delivery of healthcare is deprofessionalization of medicine. Actually, this concept originated from the barefoot doctors concept in China. Earlier in those days, these barefoot doctors, without wearing any chappals, they used to roam around from village to village providing health care. See, the health team concept is gaining attention day by day. With proper training of these grassroots level workers, field workers, we can provide efficient and effective health care. And hence, this is deprofessionalization of medicine. Doctors alone are not involved in the delivery of healthcare services. Non-medicals are also involved in the delivery of healthcare services. The key person in India who is providing these services are Anganwadi workers and ASHA. These ASHA workers are paid honorarium, and on the basis of service they are provided the salary, which led to the successful implementation of ASHA in national healthcare delivery. They were first introduced in National Rural Health Mission in the year 2006. Today there are about 9 lakh ASHA in our country and about 13 lakh Anganwadi workers in our country today working under this Anganwadi program. So they are forming the core team of deprofessionalization of medicine and healthcare delivery in India. If you like this video, press the like button and share with your friends preparing for community medicine. Kindly become a member and support my channel. Thank you very much.